To get started, Dr. Whalen's on a conference call, so she'll be here very shortly. But good morning, everyone. And sadly, Dr. Whalen, sadly, we lost 3 more county residents to the virus. A woman in her 50s, a woman in her 80s, and a woman in her 90s. To the families, my condolences and prayers go out to you. To the 265 families now that lost a loved one in Albany County to COVID-19, my love and prayers go out to you. It's a difficult time, and I wish I didn't have to say this every time, but it's hard enough what we're going through. It's hard enough to reimagine the world and the workplace, and to lose someone in general. But again, to the 3 families, and it's tough. So my condolences. So far this month, there's been 39 COVID-19 deaths in the month of January. In the month of December, we had over 63. We have 16 days left to this month, and I'm hoping not to break that record. We need people to do the right thing, continue to do the right thing. I know everyone's fatigued, they're tired. Everyone just wants life back the way it was prior to March 12th of 2020. It's never going to go back. We can only move forward, and we can only learn from our past mistakes and things we did in the past and just move forward in a positive way. And we'll get through this. The vaccine's going to take time. It's going to take a couple months to get through 1A, 1B, and the rest of it, so bear with us. We'll get there, but we need you to just understand, and I've said this before, it's a marathon, not a sprint. We got to take our time. It's going to be time before we get to where we can get the vaccine out to everyone in the county. As of today, we now have 15,284 cases of COVID-19 in Albany County. That's an increase today of 292 positive cases since yesterday. That now brings our 5-day average to 269.8 positive cases a day. Yesterday it was 267.2. Currently, there's 3,214 people under mandatory quarantine. Yesterday there was 3,438. Of the new positive cases, 43 had a close contact to a positive case, 13 are healthcare workers, 236 don't have a clear source of infection at this time. As of today, 45,442 people have now completed quarantine. 13,249 were positive cases and have recovered. That's an increase of 209 recoveries since yesterday. One of the things we continued, and that's what we did this partnership with St. Peter's Partners, is because of hospitalizations. Unfortunately, we had 29 new hospitalizations overnight, which is the most we've seen in one night. Yesterday there was 18 new hospitalizations. The day before that was 15. There are currently 168 people in a hospital from this virus. That's a record for us today, unfortunately, a record we did not want. The last highest number was 163, which happened on the 7th of January. Yesterday there were 158 people hospitalized, 8 patients currently in the ICU, and yesterday it was 7, so we went 1 up in the ICU. I'm hoping this isn't a surge for hospitalizations, but we are prepared. We got ready. We will have 160 beds to relieve the hospitals here in the Capital District, the furniture was starting to move in on Wednesday, and I believe by this time next week they will be in a situation where they can take patients out of hospitals, need be, to give up room for hospital beds for people that are seriously ill at this point. Our hospitalization bed capacity is now 24%. It's down. We were roughly around 25, 24, back and forth. It's at 24. Our ICU availability of beds went from 19% to 20, so which is good that went up a little bit. But we need people to continue to do their part. We need you to wear your mask, cough into your arm, clean your hands, and stay 6 feet apart. We'll get through it. We're going to get through it. We got no choice but to get through it. But we can do it together in a partnership as one. Aside from the health guidelines that have been put out, we're going to be able to return to any sense of normalcy by getting through this virus. Is plain and simple. Getting the vaccine out and into arms. There's been a lot of plans. There's been a lot of questions. There's been stumbling blocks to get the vaccine out. But we're all ready. Every county in the state of New York, all 57 upstate. I've talked to the county managers. I've talked to the county executives. All have a plan in place, working with the Department of Health and working with the the governor's office, and we're going to get out. You got to be patient. The drive-throughs up today and running. There's drive-throughs throughout the whole state of New York, so you're going to see this being more rapidly getting out to people. And again, but it comes to supply and demand. We have the demand, and Dr. Will will talk about the supply. We just need the supply, and there's a lot of fast action moving on that. So again, please be patient. We're working on it. We started our 211 for this reason, to help people that aren't computer savvy or having a difficult time navigating the system. I know the Department of Health is addressing it. I know the governor's office is on them to make sure they make it simple for the people to register. I know another clarification that needs to be made. If you got in for your first shot, you do not have to register for a second shot. They will do that for you the day you get your shot, and Dr. Whalen can talk about that. A lot of confusion. A lot of people were signing up for a second shot, not saying they're going for a second shot, and took slots away from people that needed it. So please, that will be taken care of, and we're trying to clear that up. But I do want to thank Legislator Bill Clay. He's chair of the Black Caucus, and he did an excellent job of, coming down, getting at our pod yesterday at the Times Union Center, which I want to say to Dr. Whalen and her team, I heard nothing but great things, how smooth it was. People were in and out under 30 minutes, and I'll let you talk about the numbers. I know there's roughly around 500 or so. But Bill Clay wanted to show that, look, he believes in the vaccine, it's safe, and to get it out to our communities, to let people know that, yes, please, as we've been rolling this out, and we'll be rolling out a PS commercial and radio stuff, is to get buy-in from the African American community and to have them understand that it is safe. And as we reached out through our Department of Aging, through the health department, social services, identified people over 75, a lot of them said no. They still don't feel comfortable. So Bill Clay, thank you from the bottom of my heart for making sure you got out in front, got that shot, and for being an advocate for your, not just where you represent as a legislator, but for the Black Caucus and everything you do for 100 black men. So Bill, thank you so much. The vaccine dispenser sites at the University of Albany, I said, open today. I want to thank President Rodriguez, who's been a great partner, great fabric of this community, working with us. To Chancellor Jim Malatras, thank you for your leadership, taking over the SUNY schools, but most importantly, for this vaccine. It's hard enough to take over a job of that magnitude that goes into it to make sure you're educating New Yorkers, and we have the best education system in the world, and then on top of this to deal with the COVID-19 and the stuff that Chancellor Malatras has done through his leadership as Chancellor in the short time that he's been there. It's been unbelievable, and to everyone that's working on it, and especially to the President Rodriguez, thank you for what you're doing. He will be here next week, and a few other university presidents to talk about reopening, because believe it or not, it's middle of January, 16 days left, and February means the college kids are coming back. So we got a game plan to make sure when they come back they still remember how to make sure they socially distance and do that other stuff, and how they're going to continue with classes. Talking about the 211, when we set that number up, I think the first day they handled over 240 calls. I haven't talked to Pete Gannon, but Pete Gannon, to you and your team, thank you so much. And one of the things he said, the biggest issue people were having was navigating the website, or waiting hours, or getting hung up. Younger people get it. They're getting appointments. There's a lot of seniors that should get this. Please wait your turn. I've heard all the stories. People go in, I'm an auxiliary member for the fire department, I'm an auxiliary member for the EMS. Get the shots in the arms of the people that need it. meaning the hospitals, the healthcare workers, the frontline essential workers for 10 months who've been coming to work every day when the non-essentials could stay home and be safe and do the right thing and help us through this. But they had to be on the front line. Let's get it to the seniors that are passing away from this, unfortunately, that it's hitting the hardest, that are 75 and above, and the 65, and the underlying issues. And one of the things I am addressing, been addressing with the health department, we're not even talking about the population of people that are homebound, that are in hospice, or they're home, they're being cared for by aides that come in, or the family members are taking care of them. We need to get shots in their arms. We need to get shots in the people taking care of them that come into their house in and out every day around the community. I've said it before, I do, and what made me think of it, I have a sister-in-law who has ALS, can't move, talks through a machine. She's only 47. And it breaks my heart that I can't get a shot in her arm and can't get her any place to get it because she doesn't fall in any of the categories. There's people walking around with diabetes, blood pressure. If you've seen the numbers in the 50s and 30s, and I know people like to hear they had underlying health issues, look at the state dashboard. The underlying health issues can be high blood pressure, diabetes, not things that are going to kill you because you're under medication, you're under doctor's care, you're doing the right thing. But we need to make sure, in all the seniors that live in apartment complexes that aren't managed or overseen by the state or county or the city or town or village it may be in, and the management company's not making sure that they take care of the seniors that are there. It's our obligation to make sure that no one falls through the cracks. But we have to address that population, and that's why I did that partnership with Mohawk to get 300,000 shots out. I'm on board right now with another medical group that said they can get 4,000 shots out to people in houses. We need to engage everyone to get this done. Everyone. Dr. Whalen.
Good morning. So before I talk about vaccine strategies, I think it's important for us not to lose sight of the fact that we're still seeing such a large prevalence of disease in the community. And I know people are heartened to hear that there's vaccine and that it's starting to get out within the community, but we are not at the point where there are enough people vaccinated. Most people have not received second doses for us to start to relax our vigilance. We need to be as vigilant as ever, especially given the situations in the local hospitals and ICUs. We want to maintain capacity. So, we're really doubling down on the message to the public that it is still very important to protect yourself. The mask is still your best protective mechanism, and for those people that have received their first vaccine, you need to keep wearing a mask. You are not fully protected, and you can still transmit disease to others, so do not stop wearing the mask once you've been vaccinated. All the same behaviors of staying at home to the extent possible, of avoiding large crowds or gatherings, and frequent hand washing, they're all as important as they've ever been. So I think that has to be the first message that I share with everyone. So the vaccine, it's good news that we're getting a supply. We're not getting the number of vaccines that we want yet, and we are able to give more. We did apply last week for a larger allotment of vaccine and received 500 doses, and I'm happy to say that we went through everything that we received. All of those vaccines have been given out. We had a pod last night at the Times Union Center. And I think perhaps for people that may be a little bit hesitant to know what happens when you get vaccine, how does a pod work? I want to reassure the public that the way we have this set up is that as people come in, they're spaced appropriately, 6 feet. It's very heavily monitored. We have people that are working there from our MRC that are just assigned to do flow to make sure that people are spaced apart. When you come in, you are met with by triage, which is greeters and triage, and they make sure that your appointment is in our system. And then we have a separate area for people to go that have limitations with walking or maybe in wheelchairs. Some of you may have come to our first pod, which was for 1A workers. At that pod, it was necessary to walk the entire perimeter of the TU Center. So if you are now looking to advise an elderly relative, please know that for our second effort, when we did have individuals over 75, we completely changed the flow, and it was really pretty easy for people to get in and get through. We monitored what it took an average person to go through, and it was about 8 to 15 minutes. So we think that we're doing a good job of getting people through. Once you go through the triage, you go to a table, and the tables are all separate. At each table, there is a vaccinator who is a medical professional, and someone who is assisting on computers who will ask your screening questions. If there are any positive screening questions, we have medical staff there to go over any questions or concerns that you have. Then your vaccine is administered, and then you are moved on to a waiting area. We ask people to wait for 15 minutes to make sure that they don't have any ill effects from the vaccine. We do have EMS on site and are able to respond to any concerns. Luckily, we have not had anyone who's experienced any ill effects of the vaccine while at our pod. Anyone who had a history of allergy would be asked to stay a little bit longer, usually about 30 minutes, if you have a history of anaphylaxis. So, and after that time, you can get up and go. At our pod, we ensure that everyone leaves with their second dose scheduled. It is 4 weeks to the day, and usually the exact same time that you get your first dose. So we try to make things as simple as possible for people. I know that there has been a lot of confusion on links that have been sent out, and we are aware of several occurrences of links being sent out to either bogus clinics or test clinics. As a matter of fact, on my way in this morning, I was called and told that there was a number of people that are congregating at a location in downtown Albany, not the health department. That was a link that was sent out to a test. This is not an actual vaccination site that's up. We also had an experience last week before we received our allotment where over 700 people signed up to our vaccination clinic. Clearly, we would not have had spots for all of those individuals. We're working with the state on how to ensure this doesn't happen, because the last thing we need is confusion within these systems. Currently, if people want to know how they can sign up for vaccine, the two websites that I would direct them to is the Capital Region Vax website, which is through the regional hub, and Am I Eligible through the New York State Department of Health. We continue to have daily calls with the hub and continue to work on issues like this so that we can give a clear message to the public how to sign up for vaccine. It's important that we continue to focus on our 1A population, the healthcare workers that are frontline and dealing with COVID on a daily basis. Even though 1B populations are eligible, the hospitals need to hone their focus on their staff that are taking care of patients so that we can continue operations. The health departments are very happy to take a role in providing as large an amount of vaccine as we can get, and we are starting to see vaccine roll into pharmacies as well. So this is all movement in the right direction, but we don't have the supply that we need. So at the health department, I'm hearing from several partners, and I know we've discussed previously, will it be a situation where school nurses give vaccine to their staff who are teachers, or will vaccine be sent to different agencies? We have tremendous will in the Capital District and tremendous partnership to be able to arrange things like this, but right now the supply isn't there. So all of the data is being collected. We are looking at ways that vaccine can be pushed out to eligible entities as it becomes available, but this is a work in progress. And right now, we don't have the supply. This is only our second week obtaining vaccine supply, so we don't really know what next week will bring. We are hopeful that we will get the amount that we have requested, but we stand ready to work with whatever we get to try to get it out to the public as quickly as possible. I know that many of you, are confused. Many of you are looking at ways that you could sign up that's easier, particularly for your elderly relatives, and we are working on that. We're working on this, but this needs to be something that is done through the regional effort so that hopefully we can get a unifying message out to the public. So I ask for patience. I ask for patience, and I ask for continued vigilance. These are systems that are really overburdened at this stage, and we know that there are many people working on them so that we can get the vaccine out. Our job is relatively easy. Once it comes to us, it goes out to those that are eligible. But organizing this on a larger scale, on the immense scale of getting vaccines into the arms of New York State is a large effort. And I think so far it's being done well because the vaccine is the rate-limiting step. It's the supply that's the rate-limiting step. I don't want anyone to think that there's vaccines sitting in fridges and for some administrative purpose it's not getting out. That's not the situation. Vaccine is getting out as it comes to the entities that get it, and we will continue to work on honing the processes to make them easily understandable for the general public going forward.
Thank you, Dr. Whalen. And I think you touched this a little bit, but one of the issues that I'm seeing, people that got the first shot within a week, they must have got COVID-19. They're positive. They have to quarantine. I think people are thinking that if they get the shot, they can't get it. Do you want to talk about that?
Right. So it is entirely possible as we've said all along, the incubation period for COVID is usually between 2 and 10 days, sometimes a little bit longer. So it is entirely possible for you to be exposed to COVID before you get the vaccine, and for you then to go on to get COVID after you get the vaccine. The first dose, any dose of a vaccine usually takes a couple of weeks before you develop antibodies. And that's the same for the flu shot too. I tell people, you can get the flu shot and then get the flu if it is within those 2 weeks while your body's developing antibodies. Even for a shot like COVID-19, which is much more effective than the flu shot, it is still possible. So that is why it's essential for people to maintain vigilance. You don't get the 95% decrease of disease until you have received the second dose and then a couple weeks after that. So people really need to understand that they remain vulnerable to infection despite obtaining vaccine.
Thank you, because it's been that question I continue to get, and they're like, well, how do I get it?
Yeah.
You have to protect yourself still. You still have to wear a mask. You still have to socially distance and cough into your arm and clean your hands. So please just don't think because you got the vaccine you're not gonna have the symptoms where you may end up in the hospital, but you can end up getting other people sick and being quarantined. So please be careful out there. Some good news is the President-elect Joe Biden. He's already talked about hosting amount of money, I think $1.9 trillion through FEMA to cover the cost of COVID-19 response. So we look forward to that. It hitting his desk at the end of the month of January and being voted on in February and getting that money out to the county, states, and towns, cities, and villages that needs it. So that's some of the good stuff. So thank you to DC, and hopefully they get it done in a timely manner. He will also be prioritizing another stimulus package that will get relief to those who continue to struggle. I know Senator Schumer is talking about the $2,000, and President-elect Joe Biden's talking about roughly stimulus money going on top of the $300 a week for people that are unemployed and hit with this. So the light's at the end of the tunnel, and that's what I keep telling everyone. We're going to get there. We're going to get through this. Just got to remember, we're in it together, and be part of the solution, not part of the problem. So again, I do want to say to the Whitney Young, thank you for the partnership. 518-465-4771. If you don't have insurance, we pay for it. And you can also schedule through UAlbany, which might be a little bit different with the drive-through. So I really have to check with them if they're still doing both at the same time. But I think they are. But their focus today is on the vaccine. So that number is 1-888-364-3065. AlbanyCounty.com. As always, go there. You can see what you qualify for if you're trying to get vaccine for your kids, or if you're trying to get a rapid test or a PCR test, please go there. And again, mental health support is available for everyone. Please don't be ashamed to call that number if you feel different, and you should. Everyone should feel different. If you have any slight compassion for anyone, and there's some people that don't have compassion for anybody, but if you have some slight compassion, things changed, and things are going to throw you off. And take that step back and make that phone call and talk to somebody. Talk to somebody that's not going to sit there and judge you on what you're feeling or saying. They're going to just sit there and listen and give you the advice that you need. And remember, to everyone out there, your threshold of pain's a lot different than other people. Some people deal with it and some don't. You know, I've had friends that I thought would be great through this crisis that weren't. I had people that I wasn't sure of that stood up and did a hell of a job. It happens. People react differently, and when they're faced with different things in the world, have some compassion. You know, I know you can't hug them, but get a mask on. If they need it, you know, just give them that fist pump and you know, tell them we'll all get through this. To people struggling with addiction, I feel bad for them too. It's a hard time for them. So please be patient with people. Someone wants to argue with you, walk away. Trust me. I mean, I feel like I'm like in the West every time I'm out. Instead of someone drawing a weapon on me, they're friggin' pulling their mask off or saying I got no mask on. It's okay. You know, I wish you'd do the right thing. I really do. But I'm not looking for an argument. I'm not looking to debate my philosophy with your philosophy. Educate yourself. Educate yourself. Go on to the CDC, World Health. Go to watch the news. Read the papers. Great stories in there. They break it down. A lot of these reporters break it down better than we are. Read it. Do yourself a favor. Educate yourself. Then I'll have that agree to disagreement with you, but we can have a logical, educational argument, not just based on your beliefs. So again, our 24-hour sexual assault hotline is available, 518-447-7716. I was about to say, because I'm used to saying the 201 number with United Way, but we're utilizing it in a different way. But to United Way, thank you for doing that. And the New York State hotline, as always. To the new people joining us, please just wear a mask, cough in your arm, clean your hands, and socially distance 6 feet. To the 265 families that lost loved ones, and anyone that lost a loved one through these difficult times, my heart goes out to you. It really does. And, you know, we'll get through it. We'll get through it together. Be safe out there. Any questions?
It's for Dr. Whalen. So you talked a little bit about the scheduling of vaccines. We had a specific case where someone called in. They scheduled the UAlbany site for the end of January, and then the next day received an email from the Department of Health that their appointment was canceled. Wondering what could have caused that, or if that's something that's happening to other people.
So that's not something I've heard of. This was through the SUNY site that has just been stood up?
It says, yeah, they signed up at the UAlbany site. It doesn't say how they signed up, but that they signed up, and then the next day received an email from the Department of Health saying that their appointment was canceled.
I can't comment on that. I don't know how that happened. I'm sorry.
Okay. For what should they do now? Should they try to reschedule, or?
So rescheduling is certainly always an option. What I do want to tell people is I know people are trying to book out at the SUNY site and not getting appointments until April. And the SUNY site, the way that they have opened up the booking is, you know, as people go in, they get sites that are available. With the vaccine supply to the other entities that are providing vaccine throughout the county, the supply comes in and then the scheduling occurs. So there may be opportunities sooner for those that scheduled out through that site. But we are scheduling. Partners take a different approach. Some like to say that they're comfortable with the number that they're getting shipped and schedule appointments. And we usually don't schedule until we know what we're going to get to avoid having to cancel appointments. So there will be additional vaccine coming into the region, but the way that the SUNY site is set up is that they have scheduled everything going forward.
All right, thanks.
So is the point of dispensing the drive-through one at Clarksville in full effect yet? And has scheduling started for the partnership with Mohawk Ambulance yet?
So I don't have information on Clarksville. I believe that there was some vaccine that was given over the weekend. In terms of the partnership with Mohawk, it's supply dependent, and as yet there has not been supply allocated.
So there will be no scheduling until there is supply, correct?
Correct.
All right, and where are we with schools? Is it still district by district? We're still in sort of a post-holiday time lull to a degree.
Yes, we are still seeing cases throughout the schools. We are still working daily with the schools to ensure that when they have cases in their doors, that we are quarantining appropriate individuals. And sometimes, because the quarantine is broader in schools, this does result in schools needing to go on pause for staffing or other considerations. But we're working with them on a daily basis.
How close are we to needing that overflow at the separate building at Shaker Place? And this is a strange way to approach it, but are you at all concerned about the optics of having COVID patients go to a nursing home facility while they're not contagious and they're in a separate building? That's something the governor is criticized for on a daily basis.
So I think that right now the situation doesn't warrant a transfer, but it is something that's being monitored on a daily basis. And while I understand the perception may be difficult for some people, it is very clear and it has been abundantly, cautiously planned that this is a separate entrance, this is separate quarters, there is not overlap of staff, so that there should not be concerns around safety.
Last week, the governor had mentioned that Johnson & Johnson was close to trials for that one-shot vaccine. Do you know anything about that? And how efficient would that make the process? How much time would that cut out, not having to have people come back for a second shot?
Well, I don't know. That's a federal decision that's being made. I don't know how close they are to making that. I know a single-shot vaccine would make things much more quick. We would be able to get a lot of people through without having to schedule that second appointment.
And the overlap with the second shot for 1A and the first shot for 1B, is that where we are right now?
Some systems are. The county isn't, as we just had our first pod last week, so we still have a couple of weeks leeway. But obviously we're planning, everybody that's doing second shots is planning around first shot, second shot clinics.
Thank you. Any other questions? Thank you. Be safe out there.
Sorry about that. I didn't realize.
What's that?